Okay, so when we think about the glomerulus, you want to remember that the capillaries in the glomerulus are what we call fenestrated capillaries. That means they've got little holes in them, and that fluid can flow out of these holes. But fluid really wants the path of least resistance, and normally the path of least resistance is for that fluid to go through this tube. That would be from the afferent to the efferent arteriole. Okay? Now, when we think about the glomerulus, I want you to remember that the glomerulus is located within the Bowman's capsule. And that the goal of the glomerulus is to push fluid into that Bowman's capsule, and in doing so, push fluid into the rest of the nephron. So that the blood is going to arrive again through the afferent, and it's going to exit through the efferent. If the afferent is more narrow than the efferent, I'm going to actually draw that in here. Then what that means is that it's harder for blood to get through this afferent into the rest of this glomerulus. And what that's going to do is it's going to decrease the flow, similar to if you had a hose with a hole in it and you were to squeeze that hose at the faucet end. Okay, now if we were to dilate the afferent end and make it really, really, really large, then what's going to happen is we're going to have a lot of fluid in here, and all of that fluid is going to want to get into this smaller area. When it tries to do that, then there's going to be a higher volume of fluid, and that means it's going to have more pressure pushing it out into the rest of the nephron. Okay. If we go ahead and now go back to our normal glomerulus. Oops. All right, I'm going to actually add on the next part of the tube. Now, if we were to go ahead and constrict the efferent arteriole, so we make this smaller, what happens is that there's pressure backup. The fluid that is coming through this tube is going to have a really hard time getting into that little tube, and what that means is that more of it is going to exit the glomerulus and go into the rest of the nephron. I hope that this video helps you to understand glomerular filtration just a little bit better. To recap, we figured out that when we increase the afferent, we increase flow, because you're going to have a greater amount of liquid heading into that afferent, and when it reaches the choke point, or a greater amount of fluid heading into that afferent, and that greater amount of fluid is going to head out. When we decrease the afferent arteriole, we create a choke point, and that makes it harder for the fluid to get through to the rest of the nephron. So that's going to decrease flow. When we decrease the efferent, that backs up the fluid and actually makes it go out of the glomerulus, again, increasing flow. And this flow is flow through it's glomerular filtration, right? So flow through the glomerulus. What your body is trying to do is it's trying to keep the flow through the nephron relatively constant. If the flow through the nephron is too fast, then you're not going to be able to reabsorb all the goodies that are going out the nephron because you're just not going to have enough time to do that. And instead, you're just going to pee it all out. If your filtration through that nephron is going too slow, then what happens is you're not really getting rid of enough waste. So what you try to do is you try to homeostatically compensate for what's going on in this in the blood by changing the glomerulus. So if your blood pressure gets really high, then what's going to happen is your body's going to need to decrease the glomerular filtration. And the way that your body does that is that it constricts the afferent. And this is to maintain homeostasis. When your blood pressure decreases, and this could even be something as simple as laying down, your body compensates by increasing your GFR, and it can do this by dilating the afferent or constricting the efferent. So the trick here in terms of exam questions is be mindful of what I'm asking. If I'm asking you what would increased blood pressure do to glomerular filtration, you're going to tell me it's going to increase it. But if I ask how would your body respond to increased glomerular filtration, then you're going to start talking about this homeostatic response where your body is compensating for the increased flow by trying to decrease it. And I know that seems like a really sort of minute detail, but it's actually really important because it's the difference between me understanding that you're looking at homeostatic compensation, or me thinking that you're telling me that increased blood pressure would result in decreased flow, which it does not. I hope that this video is kind of shedding some light on this glomerular filtration, and it helps you to understand this concept. Now, those of you who have really studied up on this are going to ask me about the podocytes and what's their role in it, because it's not just the arterioles. Remember that surrounding this glomerular capillary that's got all these little holes in it, we've got these cells that are called podocytes. And what the podocytes do is they actually cover some of those holes, making it more difficult for the fluid to come out because the fluid has to find openings. In a case where the pressure going through that glomerulus is too high, to avoid damage, what's going to happen is those podocytes are going to actually contract, getting even closer together. And once they're closer together, there are going to be fewer places where the fluid can exit that glomerulus. When the blood pressure is low, then those podocytes are able to recede a little bit more, making larger spaces, and those larger spaces will have more points where fluid can come out. Now, it's not as dramatic as what I've drawn here, but I do want you to get this idea that these podocytes are involved in changing the amount of flow that's going through. Again, they get closer together to constrict the flow coming out of this glomerulus when pressure is really high, and that's a homeostatic response to reduce the flow. And they get further apart to allow a little bit more flow if the blood pressure happens to be low, to, again, homeostatically keep the flow through the glomerulus as constant as possible.